Hey guys, we're moving on to part 3 of our PNF series. So as you can see, Teddy can't stop, won't stop, and so had decided to do a step class after already working out and now is experiencing a rather intense muscle spasm in his gastroc. So what we're going to use in terms of techniques is PNF Agonist Contract because we don't want to be directly stretching a muscle that's in spasm at this particular moment. So instead, we're going to take a look at the opposite muscle, which in typical terms we would call the antagonist to gastroc, which gastroc is responsible for plantar flexion. So coming up on our toes, and the antagonist to that would be tibialis anterior, which is going to be one of our dorsiflexors. So in PNF agonist contract, though, it's a little bit backwards. So we're going to be contracting tibialis anterior in order to reciprocally inhibit gastrocs. So when tibialis anterior fires, gastrocs by default has to sort of release to a certain degree or turn off. And so when it's in spasm, that is a helpful tool to have in our toolbox. So I'm going to take Teddy and put him into a supine position on the table here. This is the calf that is in spasm, and Teddy is quite uncomfortable. So I'm going to instruct Teddy to be doing some diaphragmatic breathing, big, deep, even breaths in and out. And I'm going to create a little bit of pillowing here behind his knees. And so what I'm going to be having Teddy do is pull his toes up towards his shin in dorsiflexion, and I am going to resist that movement. So we're going to do an isometric contraction of tibialis anterior in order to turn off the gastroc muscle. So what I'm going to do is I'm going to have Teddy pull his toes up towards his shin. I'm going to meet that resistance for a count of 7 to 10. I'm checking in with Teddy throughout this treatment to make sure that the pain isn't too intense. We're staying under a 7 out of 10, and we're going to hold here for about a count of 10. And then we may be able to increase the amount of stretch that we can place on those gastroc muscles, just a passive stretch. We don't want to put too much overpressure here. Some of the other techniques that we might want to use for muscle spasm are muscle squeezing. That might feel good as well. And we may want to repeat this technique a few times in order to achieve the result of decreasing muscle spasm in the gastrocs. So I hope this helps. Agonist in this particular instance is going to be tibialis anterior, and the antagonist in this instance is gastroc, which is the muscle that we're trying to stretch and loosen. So I hope this helps. Stay tuned for the sheet that you will be able to fill out, an interactive document to kind of further your knowledge on this topic. All right, thanks guys, bye.